These are not your usual squatters. The members of Movimento Lanterna are fighting for a basic need: access to medical health care. The group, formed by retired medical doctor Nini Formaro, takes turns in occupying a wing of this closed-down hospital in Cariati, southern Italy. It was absolutely unthinkable 10 years ago, after so many years that this hospital has been in operation, after so many years of work and all these people who have worked here in this time, that there would be a need to occupy. Formaro invites us to see for ourselves. Work is still ongoing at the Vittorio Consentino, but with so few staff, the hospital is no longer classified as such. This radiology unit used to do more than 20,000 screenings per year. Now, it's less than 300.
The Vittorio Consentino was designed to serve a community of more than 80,000 people. But after decades of mismanagement and mafia meddling in the healthcare system, it now finds itself unable to meet even basic requirements for treating patients. And this in the middle of a global pandemic.
Like the hospital in Cariati, there are 17 others in the region that are out of service. The pandemic has brought to light systemic mismanagement. The infrastructure, such as the oxygen ports at this hospital, could be used to treat COVID-19 patients, but without doctors and sufficient funds, they are useless. Dr. Formaro takes us into a separate wing built in the 90s. This part of the hospital was never properly put to use. A well-equipped hospital room for disabled patients now serves as a storage space, leaving the 66-year-old with a feeling of great bitterness. I have been a doctor in this facility for 40 years, and to think that I can't assist people, that I can't give answers, is absolutely frustrating. The healthcare situation in the entire region of Calabria is so dramatic that it was placed under the supervision of the national government 10 years ago, causing even further cuts to the health budget. In the past, hospitals were closed in order to pay off debt. What we are working on now is to recover doctors, nurses, health personnel, and above all, facilities in emergencies.
E soprattutto strutture.
Mafia infiltration of the healthcare system is another issue. A look at the hospital roof shows an elaborate solar panel and air conditioning system acquired through lucrative government contracts. Formaro says the mafia is behind it.
An
air conditioning system would be useful if it were accompanied by the fact that there are patients, inpatients. If there are no patients, then the question arises, why is this being done, and why isn't the ultrasound machine for the cardiology ward being bought? The people of Cariati, like many across the region, suffer. Patients here currently need to travel more than an hour to get to a functioning emergency room, which places a large burden, especially on the elderly. The members of Movimento Lanterna want to continue their fight to the end, until their hospital is reopened. Under the watchful eye of Commandante Che Guevara, a doctor himself, they tell us, in order to have your rights recognized, you have to start a revolution.